I'm in. I'm really old. Do I qualify for Medicare? Timmy's not in here. Does this sound any better, Nora? Tell me if this sounds any better. I know you're probably thinking, what happened? I don't know. Okay, I can hear you now. Cool. Interesting. So is my stuff going bad? What's up with that? So is Timmy actually in here, Nora, or is there somebody else in there? You said, hey, Timmy. Is he around? He's supposed to be working. He's supposed to be at work working. Oh, he's gone. No, you do not qualify for Medicare. Did you get your little red, white, and blue card? That's how you know you're on Medicare. Okay. Okay. Let's go from the top. Go, just me. What do you mean, just you? Let me take a little sippy sip. Darn. She put darn. You're not old enough. Maybe you'll make it someday. Maybe you will make it someday. Let me be serious here for just 1 minute. Got my little, like I said, I got my devoted health plans shirt on. And let me just show you this, because this is important for you to understand. This is the same company in the same state, but it's got two different areas. And one of them has, this is the Charlotte area. They've got 4 plans. And in the Winston-Salem, Greensboro area, there's 3 and 2 plans right here. So there's 5 plans in my area. So why am I telling you that? Because you've got in the same state, the same company, that's 9 different plans with one company. And that's a Medicare Advantage. So that is one of the reasons why you need to talk to someone like myself, a qualified, experienced, independent agent like myself. I'm not locked into any one company. Like I told you, I've got the Devoted Plans t-shirt on. I've got my Blue Cross Blue Shield of North Carolina collared shirt that I will be wearing. Here's United Healthcare. Here's WellCare. This pen sucks. I got 2 Humana pens. I like these Humana pens. I like this Aetna and the Cigna. They're exactly the same. I love these pens. So I'm not locked in to just one company. North Marijuana. What are you talking about? North Marijuana? What is North Marijuana? North Carolina. Send me some swag. I don't have any swag. That's the whole point. I don't have any swag. I need more swag from these companies. Devoted did give me this t-shirt, and I did get another thing. Yeah, you're not getting my pins. I love my pins. You are not getting the pins. Now, the whole point, what I was saying before Nora, she said boo. She said boo. She's not even in the age bracket that we're looking for. Typically speaking, someone who gets Medicare is someone at least 65 years old, or I have my eye on those pins. You're not getting my pins, Nora. You're not getting my pins. You're not. Just kidding. How old do I have to be? I just told you, 65. Or if you are disabled, you might qualify with the disability. I'm sorry. Just kidding, Nora. Oh, Lord. But you have to be 65 to be on Medicare. And Nora is my friend. I'm just playing, having a little fun with Nora. She's helping me promoting this so other people can see it. And if you're as nice as Nora is, then you would go ahead and comment something in the she's left us already. She came in, she popped out. But anyhow, you have to be at least 65 or on disability to get Medicare. To decide between whether you need a Medicare Advantage or a Medicare supplement, let me give you the ins and outs. I mean, there's many different companies, and you need someone to go through with you to see exactly, okay, if you're getting a Medicare Advantage, these are things that you're going to have to think about. You're going to have to think about, are my medications, if you're taking medications, are my medications in that particular plan? How much do they cost? The other thing you need to think about is, okay, are all my doctors? Oh, she said she's here. Cool. I don't know why it comes in and out on my screen of somebody there and somebody not there. But thank you, Nora, for staying in. If you have other questions, please ask them. But when you're turning 65, these are the people that I really, really want to talk to. People turning 65. Just a few crazy pills. She's got a few crazy pills. Oh. Well, that's okay. I mean, you have a few crazy pills, and that's okay. Or little pick me up pills or whatever. Some people have other pills, but I'm going to go over some of that with you and share with you some of the things that happen, because with a supplement. Good morning, sunshine. Hello, Miss Southern Belle. How are you doing? I need to be higher up. I can't see over these. Let me get it a little bit. Let me see without turning it. All right. Is that better? A little bit, not much. Oh, I guess she was talking to Nora. Thank you guys for dropping in. I am 68 years old. Fantastic, Mrs. Southern Belle. Mrs. Southern Belle. Mrs. Southern Belle, where are you located? What city are you in? What state are you in, if you don't mind us asking? And do you have your own channel? Tell us about your channel here. She's a 68. Evidently, she is Miss Southern Belle, so she's obviously somewhere. Miss Southern Belle, please tell us. She said, "Hey, Stock Explorer, I just took my vitamins." Well, okay, let's talk about that a second, because when you're talking about the Advantage program, oh, she's in Georgia, Marietta. Coloring book coins. Marietta, Georgia. Cool. So I guess I need to get my license in Marietta, Georgia. So seriously, Mrs. Southern Belle, do you have a supplement, or do you have an Advantage plan? I don't know what size place Marietta, Georgia is. And I'm not sure exactly where it's, what it's, is it close to Atlanta? Everybody knows Atlanta, okay? But, oh my goodness, I can hear, hold on. Oh my goodness, the dog is out. Next door neighbor's dog is out. Thank you for coming in. I really do appreciate it. So you have coloring book coins. Hold on, I don't know what that is. Yeah, I know she has a channel. Okay, let's see here. She's covered in insurance. I know, honey. I'm asking, do you have a Medicare Advantage, or do you have a supplement? Do you know? Because this is the thing, is a lot of times people don't necessarily know all that they have. It's amazing. That's her interest. Coloring books, and coins. Okay. She knows all about coloring books and coins. The only reason I was asking is a lot of times people do not know. And let me ask you this, because a lot of people, especially the boomers today, don't necessarily go on Medicare right at 65. And they're waiting later because they're still working and they have coverage through their work. And, you will be able to, you know, when you're going on Medicare, if you have the opportunity and you go on Medicare and you do not pick up a Part D or get a Medicare Advantage plan that has a drug coverage included in it, then you can be penalized, and we don't want that to happen to you. So those are some of the reasons that I was actually asking. I'm not going to try to sell you anything right here today. I just wanted to ask and see, because and it depends on. Let's see what she says here. I have everything I have at my place where I am being buried. I have a living. Okay, well, yeah, no, just talking about I'm just talking about Medicare. I was talking about, did you go on Medicare at 65? Because you said you were 68 years old and you take vitamins. So she's obviously, if that's all she does is take some vitamins, she's in pretty good health. I can kind of figure that out. One of the differences between a Medicare Advantage and a Medicare supplement is the Medicare Advantage will actually give you money so that you can purchase those vitamins and you not have to pay for it. It comes up out of the plan free to you. You just use it the way that the Advantage plan tells you to do. So that's the reason I was asking, and I'm glad she had that in there, because this gives you an idea. She may not even know. I'm not in Georgia. I'm not familiar with the market. And like I said, here in North Carolina, not North marijuana, nor North Carolina, we've got the same company, and it doesn't even cover the whole entire state of a Medicare Advantage. One of them, the Charlotte, has 4 plans, different plans, and the Greensboro Winston-Salem one has 5 plans. It has 5. So that's 9 plans from one Medicare Advantage, and that's just one company. So there's many, many companies. So that's where you need an expert to get through the mire of having to deal with the situation. Now, you have, with a Medicare supplement, like I said before, some people you're going to either pay at the beginning, or you're going to have to pay at the somewhere in between. You're going to pay no matter which plan that you're on. You're either going to pay the monthly premium and know that's all I have to worry about is that monthly premium, and that would be with a Medicare supplement, and most everything else is going to be taken care of, and I'm not going to have to worry about a network to have to be in, because in the Medicare Advantage world, you have your drug plan is included in that, but you can either have a PPO or an HMO, and the HMO is more restrictive, and if you use services that are not covered by the HMO, then you are totally, and I do reiterate this, thanks for coming in, Mrs. Southern Belle. I really appreciate that. You must be a really good friend to Nora to come in. I really, really do appreciate that. But this is the deal is, and Nora, I wish you would get the the woman, the Granny. I wish Granny would come on here. I don't know what her name or the channel that she's on, but I would love to have her in here. Anyhow, you're going to have to pay one or the other, either upfront in the premium, and you may be paying a premium and you don't know when your health is going to get bad, so you still have to pay the premium, or you can have the Medicare Advantage and you get some of the other perks and benefits and the advantages, which is like getting your vitamins paid for, having the drug plan included in it, so there's no extra expense. What I mean by there's no additional premium other than what you're paying to Medicare. Now, like I said before, I have to take a little drink. My throat is a little bit dry. But you have, you're going to get the gym membership. You're going to get the vitamins. You're going to get hearing aids. You're at a specific price that's included. You're going to have dental coverage that's included in the Advantage plans. You're going to have access to money that's going to be applied toward your vision. She understands. Thank you for thank you for understanding, Mrs. Bell. But so you have two choices there. And that's how it is going to be. Now, it also is determined by, okay, the Advantage plan has no additional premium other than what you're paying for Medicare, but the supplement does have a premium associated with it. You got Medicare, the supplement, and you also have to pick up your Part D drug coverage. So there's three things that you're paying for, but it is more complete coverage. It doesn't have some of the other things that the Advantage thing has, but there are no networks that you have to worry about. Like with this particular company, the Devoted Health Plans, they are not in every county in North Carolina. They're in specific counties. So they also have a PPO and an HMO, so you have to stay in the network with the HMO. If you go outside the HMO, then you will have to pay for that all yourself without any help from Medicare or anything else. With a PPO, you can go outside of the network, but it's going to be more expensive. There is absolutely no network with the Medicare supplement. If you're, and I'll give the example that I gave earlier before my microphone was terrible and not working well. My aunt and uncle had their Medicare plans with me. My uncle had a Medicare Advantage. My aunt had a supplement, and she chose the supplement because she had had breast cancer when she was about 63 or so. So she wanted that gave her satisfaction that she wanted to have the best coverage in case she were to, have another onslaught of cancer. And she actually didn't even pass away from cancer. And she lived, I think she was 84 or 5. She lived quite a long time. I guess about 20 years after she had the breast cancer. But anyhow, the point of the matter is it is all a matter of helping you to decide which company it fits you best. Now, I told you the situation with, I got the Fitbit. I got this Fitbit, and one of the Medicare supplement companies that I work with, they will actually give you a discount if you have a Fitbit or an Apple Watch or something like that. Because this Fitbit, it is absolutely wonderful, and I totally love it. It tells you how, you need to be active. It will monitor your heart. There's a lot of things that it can do. Now, the Apple Watch also has some of those things, and it will keep make sure your heart's okay and stuff like that. But it will also save your life if you were in an avalanche or something like that, or got whatever. An Apple Watch can actually save you because it can ping and be right on you. So I anticipate, let me just get a little bit techie and a little bit, which I'm not really a techie person, but I'm going to tell you that these Medicare Advantage plans and the Medicare supplement plans in my opinion, will get more, they will promote more and more of stuff like this so that they can monitor and see that you are doing well. Because the whole point of the Medicare Advantage plans wanting you to have a gym membership is so that you can be healthy and not cost the company that much money. That's why they want you to go to the gym, and they're willing to pay for you to be a part of a gym so you can do that. The Medicare supplements don't necessarily do that, but I'm telling you, they will both be going towards more towards that type of situation, trying to promote people to be. And the other thing about the Medicare Advantages, they a lot of times will they want you to go get your physical every year to make sure you're healthy, and make sure they can catch the stuff early, preventive early stuff. So, that's some of the differences between the Advantage and the supplement. But you're going to have to pay one way or the other. The only thing about the Medicare Advantage is, if you're healthy, you're going to be, you're going to be living life high on the hog because you don't have a bunch of premiums that you're having to pay. But at the moment that you become unhealthy, and things happen, everybody at some point, unless somebody, you get run over by a car, or shot by a gun, or whatever, we will all pass away because we get older and something happens, our health begins to fail. Typically speaking, the majority of us will pass away because our health begins to decline. The thing about the Medicare supplement is you are not necessarily going to be able to get a Medicare supplement just at any time that you want to. At some point, there are, like I have some of my clients who are no longer able to move from supplement to supplement. Now, typically speaking, most people, if they have just something happen and they are doing pretty good with it, if you develop Alzheimer's at some point, then you're not going to be able to switch to another Medicare supplement. They just will not let you do that. There's certain things that they're not going to. If you're in the middle of a cancer treatment, you're not going to be able to switch to a Medicare supplement. You could go from Medicare Advantage to Medicare Advantage because that's not something that it's not a disqualifier. Most of the time, the difference is you're replacing Medicare with the Advantage plan. So there is, you get Medicare regardless of your health. That's the whole idea, right? Hold on. So those are some of the main things that I wanted to go over to let you know. And what I do is I usually go through and let you see what your particular situation is. I mean, if you're getting just Part D, it could be totally different than if you are getting a Medicare Advantage plan as far as your drugs and those type of things. But I will actually go through, look at your drug list, make sure that you are getting the best deal possible. So let's see. She said, I've heard that before. I also heard some insurance give free meals delivered. They do give free meal deliveries. That is typically, most all of them have that included. If you are coming home from the hospital, they'll give you 2 weeks that they will send it home so that because after you've been in the hospital and you're dismissed and at home, it's very important for you to regain your health and stuff, and you will get food delivered to your home by the Medicare Advantage plans because they want you to recover quickly. And part of that is having the right type of food. So that is one of the things that Medicare Advantage plans have. The supplements do not. Thank you, Miss Southern Belle. See, that's why I wanted somebody that had a little bit of experience with Medicare, even though she's probably not had that much experience because she's pretty healthy. But those are some of the things that you have to look at. And if you are interested and you do need some help, because this is the other thing is with a Medicare Advantage, let's go over that. They will change year to year, and that is why they always blast the commercials nonstop. From October 15th through December 7th, you have a limited amount of time that you can change your plan. That would be your Medicare Advantage plan or your Part D plan. If you do not get and change your plan in the middle of that, like if you're over 65 and you're not just turning 65 or just now going on Medicare or leaving your job, then you are locked out of getting a Medicare Advantage or a Medicare Part D unless there is a special um, a special opportunity for you to do it, and they're far and few between. Okay, let me just say that. So that's why they blast it all the time in the commercials to make sure that if you are wanting to change, you go ahead and change, or if you haven't signed up for something and you need to sign up, you need to go ahead and sign up in this time period. It's 54 days. 54 days that you need to make sure that you're making the changes. Now listen, a Medicare supplement you can change any time of the year. The Medicare supplements are basically this. They are set in stone and they will cover the things that Medicare does not cover. Now, if Medicare does not cover something, your supplement will not cover something. Okay? So the important thing there is you need to, if you're going to get another Part D plan, if you've got more drugs that you're having to take, you need to review it with someone like myself. If you would like information, you can go to www.michellemerard.com and you can request information, and I can speak to you. I can speak to you over the phone. I can speak to you face to face if you live in North Carolina. I'm not going to, and possibly Virginia. I do have some clients in Virginia. I got a couple. Had a client that moved. They will also come in your home. Yes, I will come to your house. But you have to have, there's certain requirements that Medicare requires that I do. That's why you need to contact me at www.michellemerard.com. I'll give you my Medicare number too. I'm going to give you my Medicare number. This is the number that you can reach out to me. Let's see. The Medicare number is 336-892-8370. 336-892-8370. And if you call me, you know what? Nora, the Stock Explorer, try it out. 336, let me put it up there. Let me put it in here. 336-892-8370. And, okay. No. Nora, call it. I want driving to work good stream. Nora's not going to do it. Okay, Miss Southern Belle, how about you do it for me? Call it, and I'm going to answer the phone just to make sure. Okay. Let's see. Hello? Hello? Hello?
Hello, hi, my name is Jan and I'm calling.
Oh my goodness. That was a spam call. Okay, come on, Miss Southern Belle. I put my number in. I'll call you just to bug you, Michelle. Just do it. Just do it, Nora. Come on, I want to show people that I actually answer the phone call. 336-892. This is my Medicare number. This is not my regular number. This is my Medicare number, but it will come in through to my phone, and you will talk to me. So Jack Gallman is in North Carolina. Who's Jack Gallman? I'm in Greensboro, North Carolina, but I have clients from the mountains to the coast. and we have everything in between. And we are a beautiful state, but we're all full up, just like Florida's filled up, according to Nora. Seriously, Mrs. Southern Belle, go ahead and just call, and you'll be on my stream. I just want to prove to people. I wish Tim would. Let me see if I can get Tim to call me, or my sister. Let me see. Yeah, see if Cheryl will call me. I'll see if she will. My Medicare number. I'm going to see if she will answer. I just want you to know that I will absolutely answer the phone. See if she'll do it. I don't know if she will or not. Let's see what this is. My Medicare number, but it will come in. Oh my goodness! Who am I speaking with?
Hello.
Hey.
Hello.
Hey.
Hey, it's Miss Southern Belle.
Oh my gosh, you're on with me. Thank you for calling.
So Jack Galman lives in North Carolina.
Who is Jack Galman?
I shared you out to Jack Galman. He's a YouTuber.
Oh, okay. You are fantastic. Thank you so much for calling. This is what happens. I will answer the phone and I will help you. But thank you, Miss Southern Belle. I'll let you go right now, and you can watch the stream for a few more minutes. Thank you so much.
Alrighty, bye-bye.
Bye. That was so nice of her. Oh my gosh. So see, I answer the phone. Miss Southern Belle, I have a license in other states. I can write business in other states. I have Virginia, Alabama, Texas, Oregon. I guess that's all. North Carolina. Those are 5, and I need 5 more. But you know, if you need assistance, if you do need assistance, I can get licensed in your state. You know, this is. I called you answer. Thank you, Miss Southern Belle. I really appreciate that. You don't know. Thank you guys so much for coming. If you do have questions, like she had the question of she takes vitamins. She doesn't even take regular drugs. She just takes vitamins. Well, the thing of that is a Medicare Advantage has the ability to pay for her vitamins. Now, I'm not telling her to switch. I'm just saying this is some of the differences that you may want to talk to someone like myself to find those answers out. Because look, if her doctor is not in the network, and remember, the Medicare Advantage plans all have networks that you have to go to. So if she is in an area that doesn't acknowledge very many of the networks, or she doesn't like the changes that take place, then she may want to go ahead and pay for her vitamins and get a Medicare supplement that she would have to pay for. But that is some of the differences that you have in this type of situation. Nora said, I was going to ask what you're wearing. What am I wearing? I'm wearing clothes. This is Devoted Health Plans. This Medicare Advantage company. They gave me this t-shirt, and I'm wearing it because I wanted to do the live stream. I've got a Blue Cross Blue Shield of North Carolina shirt that I'm going to do something with, but I just wanted to share with you and let you know, hey, look, if I'm wearing the shirt, you might want to check it out and see if it's something appropriate for you. But this is how I determine. I go through and I make sure that your drugs are covered, your doctors are in the network. Those are important things to find out. Now, if you just want complete coverage and you don't mind pay, and you would rather have the comfort and of knowing that, hey, if Medicare pays on something, then all I have to do is pay the premium, and the supplement's going to pay whatever the Medicare does not pay for, then the supplement may be the way that you would want to go. Or if you live in a very rural area and the doctors do not, they don't accept the Medicare Advantage plans, then those are things that you need to know. And that's where I can come in and help you. Now, I said this. I said this before, that really the thing about it is, I'm going to assist you. And if you go straight to the Devoted's website and you say, I don't need an agent, I'm going to tell you that is not necessarily the best thing for you, because I am there to be an advocate on your behalf. I'm there like the Medicare supplement person that's wanting to buy something and they go straight to the company. They may not know anything about the wearable, but I can tell you, hey, if you wear that Fitbit, I can get you an extra benefit. I can get you an extra discount on your coverage. And the fact of the matter is the companies need me to, they want to impress me, and therefore they want to tell me all about them, and then I can tell you what the difference as far as my experience between different companies and different situations. That's the value of having an agent with you. So anyhow, those are the main differences. I really appreciate everybody coming in, but I've got to go straight back to work. Nora's going to work. She said, oh, she's going to ask. Let's see. Texas. Let's see. Hello.
Hello.
This
is this the Michelle Morar, the famous YouTuber?
I don't know about famous. Is this the Nora, the Stock Explorer?
It is indeed. It is Nora, the Stock Explorer.
Are you on Medicare? Are you
I have 15 more years to go.
You got a little ways to go. Okay. All right. Well, listen. Hold on just a second, and I'm going to end this stream, but there's Nora. She's called in. Now she will always be aggravating me. But always. That's my Medicare number. Anyhow, hold on a second, Nora. Hold on. All right. Thank you, guys. I really appreciate you coming in. Miss Southern Belle, especially you. You had very good questions. Anybody else, you can give me a thumbs up, subscribe to the channel, and get the notification bell on, because then you'll be able to know when I go live, because I am going to be doing this a lot, because I think it's very important to get the information out to the people. Thank you, and I'll see you next time.